7 signs you have a vaginal yeast infection. Vaginal yeast infection, medically known as vaginal candidiasis, is a fungal issue causing irritation, discharge, and significant itchiness in the vagina and vulva area, the tissues surrounding the vaginal opening. This condition affects about 3 out of 4 women during their lifetimes, with many experiencing at least 2 separate occurrences. While not classified as a sexually transmitted infection, the onset of regular sexual activity may heighten the risk of developing a vaginal yeast infection. Additionally, there's some indication that these infections could be associated with oral genital contact. Active medications are available for treating vaginal yeast infections. However, if you suffer from recurrent episodes 4 or more within a year, a more extended treatment plan and a maintenance strategy might be necessary. If you are enjoying this video already, don't forget to smash the red button to subscribe and the bell button to get notified when we upload new health videos. So, what exactly causes this infection? Candida albicans, a type of fungus, is the primary cause behind the majority of vaginal yeast infections. Typically, your vagina hosts a harmonious blend of yeast, including Candida and various bacteria. Specific bacteria, such as lactobacillus, play a role in maintaining this balance, preventing an excessive growth of yeast. However, this equilibrium can be disturbed if there's an overgrowth of Candida or if the fungus penetrates deeper layers of vaginal cells. It leads to the manifestation of signs and symptoms associated with a yeast infection. Common causes include overgrowth of yeast can result from antibiotic use, which causes an imbalance in natural vaginal flora, pregnancy, uncontrolled diabetes, an impaired immune system, taking oral contraceptives or hormone therapy that increase estrogen levels. While Candida albicans stands as the primary fungus responsible for yeast infections, infections triggered by other Candida species can pose greater treatment challenges, often requiring more aggressive therapeutic approaches. To identify a potential yeast infection, here are some initial signs to watch. Number 10. Itching and irritation in the vagina and vulva. Itching and irritation in the vagina and vulva can be indicative of various conditions or infections, including yeast infections, bacterial vaginosis, sexually transmitted infections, contact dermatitis, or other allergic reactions. These symptoms should not be ignored, especially if they persist or worsen over time. Seeking prompt medical advice and examination by a healthcare professional is crucial to accurately diagnose the underlying cause and initiate appropriate treatment. Number 6. A burning sensation during urination. Experiencing a burning sensation during urination can be a symptom associated with a vaginal yeast infection, albeit it's not always the most common or prominent sign. However, some individuals with a yeast infection might encounter this discomfort. The burning sensation during urination in the context of a vaginal yeast infection is typically caused by the irritation and inflammation of the surrounding tissues. When the vaginal area is inflamed due to a yeast overgrowth, urination can exacerbate the discomfort, leading to a burning sensation. It's important to note that while a burning sensation during urination might occur with a yeast infection, it's more commonly associated with other conditions such as urinary tract infections at UTIs or sexually transmitted infections. Therefore, if this symptom persists or is accompanied by other concerning symptoms like abnormal discharge, itching, or soreness in the vaginal area, seeking medical advice for proper evaluation and diagnosis is recommended. Number 5. Redness and swelling of the vulva. Redness and swelling of the vulva alongside discomfort during urination can indicate a vaginal yeast infection in some cases. These symptoms occur due to the inflammation and irritation caused by the overgrowth of yeast, particularly Candida species, in the vagina. When a yeast infection affects the vulva, it can lead to a redness where the skin around the vaginal opening vulva may appear redder than usual due to increased blood flow and inflammation caused by the yeast infection, as well as swelling where the tissues of the vulva might become swollen or appear slightly enlarged due to the irritation caused by the yeast overgrowth. Number 4. Vaginal rash. Experiencing a vaginal rash, especially in conjunction with discomfort during urination, can sometimes be associated with a vaginal yeast infection where the skin may develop a rash-like texture. characterized by raised or bumpy areas, and it might feel rough or uneven to the touch. It's important to note that a vaginal rash and discomfort during urination might not always be solely indicative of a yeast infection. These symptoms can also be caused by other conditions such as allergic reactions, dermatitis, or other infections. If you notice a vaginal rash or experience discomfort during urination, along with other symptoms like unusual discharge, itching, or swelling in the vaginal area, seeking medical advice for proper evaluation and diagnosis is recommended to determine the underlying cause and receive appropriate treatment. Number 3. Vaginal soreness. Vaginal soreness, a prevalent symptom linked to a vaginal yeast infection, stems from the inflammatory response within the delicate tissues surrounding the vaginal area. The overgrowth of yeast, particularly Candida species, disrupts the natural balance of microorganisms in the vagina, triggering irritation and discomfort. The vaginal tissues become more sensitive and tender to the touch due to the irritation caused by the yeast overgrowth. Even gentle contact or movement can provoke discomfort. Additionally, the soreness can be accompanied by a sense of rawness or a feeling of being raw in the vaginal area, adding to the overall discomfort and unease experienced by the individual. Number 2. Painful intercourse. Experiencing pain during sexual intercourse, known as dyspareunia, can sometimes be a symptom associated with a vaginal yeast infection. When affected by a yeast infection, engaging in sexual activity can exacerbate discomfort due to the irritation and inflammation of the vaginal tissues caused by the overgrowth of yeast, particularly Candida species. The presence of excessive yeast, notably Candida species, disrupts the normal balance of microorganisms in the vagina. This overgrowth leads to irritation and inflammation of the vaginal tissues, making them more sensitive and prone to discomfort, particularly during friction or penetration. Following sexual intercourse, the already irritated vaginal area can experience heightened discomfort. The friction and contact during intercourse may exacerbate the irritation, causing increased soreness or pain post-coitus. Number 1. Thick, white, odorless cottage, cheese-like vaginal discharge. A hallmark symptom of a vaginal yeast infection is the presence of a distinctive vaginal discharge that resembles thick, white, odorless cottage cheese. This discharge is often a result of the overgrowth of yeast, particularly Candida species, in the vaginal area. Key characteristics of discharge in the context of a yeast infection include: the discharge appears thick, resembling the consistency of cottage cheese or yogurt. It's often white or slightly off-white in color and has a clumpy or curd-like texture. While the amount of discharge can vary, individuals may notice an increase in the volume of this characteristic discharge during a yeast infection. It might be more prominent than the usual vaginal secretions. And unlike some other vaginal infections, this discharge typically does not have a strong or foul odor. It is usually odorless or might have a faint yeasty scent. On numerous occasions, the symptoms of a yeast infection closely resemble those experienced with a sexually transmitted infection or other vaginal infections. If you encounter any of these symptoms, it's advisable to reach out to your healthcare provider for an examination and proper evaluation. Finally, here's some health tips to preventing a vaginal yeast infection. To reduce your risk of vaginal yeast infections, wear underwear that has a cotton crotch and doesn't fit too tightly. Avoid tight-fitting pantyhose. Avoid douching, which removes some of the normal bacteria in the vagina that protect you from infection. Avoid scented feminine products, including bubble bath, pads, and tampons. Avoid hot tubs and very hot baths. Avoid unnecessary antibiotic use, such as for colds or other viral infections. Avoid staying in wet clothes, such as swimsuits and workout attire, for long periods of time. Yeast infections can be quite frustrating, making you feel uncomfortable in your own skin. Although it might be tempting to overlook the symptoms, candidiasis typically worsens if left untreated. Fortunately, there are several treatment options available to alleviate your discomfort. Many pharmacies offer creams or suppositories designed to soothe skin irritation and eliminate excess yeast. In more severe cases, consulting your healthcare provider is Your practitioner can confirm if a yeast infection is the root cause of your discomfort and may prescribe an oral antibiotic tablet or other medications like boric acid. These treatment approaches can help you regain comfort in your own skin. If you're content like this, remember to hit the subscribe button and enable notifications for further engaging health-related videos.